We are back. We are ready for you. With new routine following COVID-19 protocol. The day before your appointment, we call you for COVID symptom screening. Anybody shows symptoms will be rescheduled. On your appointment date, please call us when you arrive at our parking lot. We have to verify you still have no COVID symptom. We apply social distancing. You wait in your car. We will call you when your treatment room is ready. Come alone with your mask. If you have to come with someone, only one person can come with you. The first thing you do when you get in our office is wash your hand with hand sanitizer. We check your temperature with infrared thermometer. We wear additional PPE for protection. Cap, goggle, N95 plus surgical mask, face shield, double-layer disposable gloves, isolation gown, water repel pants, and shoe covers. Extra oil suction, window fan, ISO-dry, medical-grade air purifier are used in our office to control air quality. They remove the risk of virus infection by safely remove droplets and aerosol particles created during dental treatment. We add extra disinfection. Front desk surface, door handle are wiped each time after you come in or leave our office. Disposable plastic covers are used to cover everywhere in the treatment room. They are removed after each patient. All the surfaces are wiped. Hypochlorite acid solution spray are used to disinfect the treatment room after we wipe the room, disinfect ourselves, disinfect other part of our office. We call you 24 to 48 hours after your visit to check on you and see if any new symptom developed. This is Dr. Zhu from Hunterdon Family Dental Care. I made this video for my patients, friends, and other dentists who might be wondering how dental office can reopen with the coronavirus infection still going on. The rest of this video explains how I came up with this protocol and includes details of the products I use. We're in New Jersey. I have seen emergency patients during the shutdown time. I see patients through telemedicine first. Screen them. I only see the true emergency in my office. This is me seeing an emergency patient wearing all the gears. I was extremely hot with everything covered on me. I cannot see very well. I know we have to do some changes in our office. This virus will not go away soon. I start to look into what change we can do in our office. There was no recommendation from ADA, CDC, OSHA on what dental office should do except shut down the office, only see the real emergency patient to prevent them from going to the hospital. We know we can find a lot of coronavirus in the mouth and saliva. High-speed handpiece will generate aerosol. The virus stay in aerosol can float in the room for 3 to 4 hours. Coronavirus is an airborne disease in dental office. Dental office regular infection control is not enough for it. Airborne disease is usually treated in hospital with air flowing to one direction only and using special air purification system to clean the air, so the air pathogen will not stay in the room or spread back to the clean area. So I look into the hospital setting and apply their infection control concept in our office. The first thing I did was I ordered 8 window fans from Amazon.com. They're very easy to be put on the window in the morning and take off at night. So the air in the room only go out of the window, not circle back to other parts of the office. If any virus generate in the aerosol, it will go out of the window. I know only having windows fan is not enough. I have a room without a window. Also, if the weather is very bad, I have to close the window. I find surgical grade air purification system used in the hospital that can filter the virus out. I ordered 6 air purifiers from 2 different companies. They are very similar, both made in Canada, both use HEPA filter out 99.99% virus and UV light and other things to kill virus inside. The reason I order from 2 different companies is they're both in back order. I do not know which one will come to us first. One of them will come sooner, then I can start to use them. I also look into other countries who are ahead of US in coronavirus control in dental field. Korea did a great job. Their country did not shut down. Their business, school, activity ran normal. No dental professional gets sick from coronavirus. They use hypochlorous acid to fog the treatment room after each dental patient. I did some search. I found a research article in 2014 about using hypochlorous acid solution to kill flu virus. Spray of hypochlorous acid solution at concentration of both 100 and 200 ppm can kill virus in 5 seconds. It is relatively safe for human, plants, and animal. It was recommended to be used to disinfect animal farm personnel and visitor. Hypochlorous acid is actually used to disinfect vehicles and hotels now. So I ordered the same blower used in Korea from Amazon.com and hypochlorous acid solution from Ionogen. In addition, I found China, Korea, Japan, Israel use actual oral suction. Things splash out when we drill, the droplet aerosol can be suctioned away into the actual oral suction. Inside the suction has HEPA filter to block the virus, plasma disinfection, and UV sterilization to kill the virus. Again, I order from 2 different companies. They work the same. Both are in back order, so whichever one comes in sooner will help me. We also use IsoDry for every patient if we can. IsoDry is an intraoral suction. It is also a bite block. People bite on this end, and this end will wrap around the teeth. It suctions the liquid away and blocks things coming out of the mouth. When we were waiting for the equipment, we made some interim one by ourselves so we can take care of emergency patients. We made our own extraoral suction with shield. We ordered a clear rubber mixing bowl from cosmetics, the plastic shell, and the cell phone holder from Amazon.com. My assistant Sandra, she's very handy. She put this together. This suction is not as strong as the suction from the machine, but it helps us before my order comes in. For PPE, we're lucky. It is very difficult to get PPE now. They're all in back order. In March, we bought a lot of masks through my doctor friends in China and donate them to local hospital and residents. I got some N95 and surgical masks for ourselves as well. The caps we used were sold by myself. I cannot get the order to come soon enough. So I took my daughter's old bed sheets, used it to sew caps with 2 buttons on it. The surgical mask hook on the buttons instead of our ears. This relieved the pressure on our ears. We ordered a lot of protective gum before coronavirus, so we don't have to worry about the back order now. We got some good quality goggles, disposable face shield, shoe covers from local Chinese communities. They were the leftover things from donation to local hospitals. When people know we need them, they donate to us. I ordered additional shoe cover from Amazon and different gloves from Henry Schein. We put double gloves for each patient. The long cuff one goes inside and short cuff one goes outside. When we sit down, our pants cannot be protected by gowns and shoe cover completely. I bought some water repel hiking pants for the office. They are comfortable. Any splash on the pants will not go inside. I recently found this face shield. Reusable, clear, big covering area, plenty of room for loop and air to breathe can be flipped up. My goggle does not get fogging anymore. We spent a week training the whole office on how to put on and take off all the PPE safely without cross-contamination, and how to thoroughly clean our office in between patients. We add additional 15 minutes for cleaning our room after each patient. As time goes on, ADA, CDC, OSHA slowly gave out guidelines on how dental office can reopen. We make sure we follow all the guidelines. Also, my orders slowly came in. Actual oral section, air purification, hypochlorite acid blower, they all came in. Our office infection control has been upgraded to a new higher level. With the extra protection, we don't have to wear hazmat suits anymore. No more goggle fogging, we can see a lot better.